Hi, welcome to Pregnancy Magazine's Basics. Today we're going to be talking to Irene Zoppi, who's a clinical education specialist with Medela. Welcome, Irene. Thanks for being here today to talk about the new healthcare legislation and how it can help make breastfeeding easier for new moms. We should just probably get a general overview. First of all, most of us are familiar with the Affordable Care Act, but how does it help new moms support breastfeeding?
Hi, Kendra. Thanks so much for the invitation to join you today. The Affordable Care Act, which of course was signed into legislation in March of 2010, has many provisions in it. And one of the exciting provisions is really about for those mothers breastfeeding or choosing to breastfeed their infants, we're able to provide them with a breast pump and breastfeeding accessories as well as breastfeeding support through their health plans. So the health plans are now required to provide these services for mothers. And for mothers who are separated from their infants through necessities, such as through having to go back to work or perhaps even going back to school, having the appropriate pump can really be a wonderful service for this mom, because she's able to extend her breastfeeding experience a bit longer, and ultimately her infant is able to receive breast milk for an extended period of time if she is in fact separated from her infant. So it's a real great opportunity.
Yeah, I mean, breast pumps are a wonderful thing. I definitely used mine many times a day. So the ACA benefit then covers breast pumps for sure, it sounds like, from what you're saying, but is there anything else that new moms can get with the ACA benefit? Can they get things like lactation support? I know I saw a lactation consultant.
Yes, the ACA does provide for lactation support through coverage through lactation individuals, for example, but it also provides for breastfeeding accessories in addition to the breast pump.
Cool. So you can get really all your cleaning supplies, your bottles,
exactly what would be covered under the feeding accessories or parts would be individualized to a particular health plan in terms of what they may cover. But moms are able to, if they have a FSA, a flexible spending account, or a health savings account, be able to purchase those accessories with those particular services that they may have. And it's always advisable that the mothers would contact their flexible spending account first to find out exactly what might be covered and to save all detailed receipts, because they may have to submit those to the account manager.
So just like I would go buy a prescription or certain FSA eligible medications, I could do the same with my breastfeeding supplies.
Yes, and so the advice we would give to mothers is check first with your FSA account as to what exactly the supplies that would be covered.
That's amazing. Wow. And do you know, are the benefits the same across all insurances for breast pumps? How does that differ?
So the actual law provides, without a copay, that health insurance plans provide a breast pump for a mom. So the health insurance companies are really shaping their breast pump coverage policies right now. And what may work for one particular company may not be the same for another. There is a stipulation that they cover a breast pump, but there are many definitions of what a breast pump would be. So the best advice that we could offer mothers is to find out exactly the coverage that their health plan provides for. And on the back of our insurance cards, there's usually a toll-free number that a member could call their insurance company and speak to a company representative that would give them the information of what particular particular product in terms of a breast pump that their health plan actually covers. And the mother then can ask about other options. For example, if there is a pump that the mother is not familiar with, or that the mother would like to trade, for example, up to a different type of pump, she needs to ask about that for her individual plan. It's about more than half of the insurance plans will allow you to pay up in terms of buying up a different type of pump, but not all health care plans are forthcoming. They don't openly communicate that to the mothers, so it's important for the mother to be able to ask those kinds of questions. If I'm not getting the pump that I'm familiar with or that I thought I would like to get, how may I go about doing that? Is there a provision for me to do that? Most of the time, it's something that the mother would pay, for example, either with her flexible spending account or pay out of pocket to change the pump that the health plan is actually providing. So it's not the same for all health plans, and like I said, the health insurance plans are really trying to shape their own breast pump coverages at this point. But there are ways for moms to keep digging, keep asking the questions. How can I get about getting a different pump? And most of the time, the health plans are very flexible about providing a pump that might not be available through their plan, but asking the appropriate questions. How can I go about getting that particular pump?
So that sounds like that's a real key question then to ask is, you know, are there any other pumps, or is there any way I can get a different pump? Do you have other key questions that you think new moms should definitely write down before they make that call? Because you know, with the insurance company, you can end up on hold for a while. So to have a list of questions ready so you don't have to make a call, are there other things you would recommend asking?
Sure.
For sure.
Definitely want to know when you would get the pump. Some plans are providing the pump before the infant is delivered. Many times, however, it's not until after the infant is delivered. So moms might want to ask that kind of a question, and exactly the type of pump that would be offered to them. For example, there are many categories of pumps. There are those that are double electric pumps, there are battery operated, and there are manual pumps. So what type of pump is it that their particular plan is actually covering? And most often moms will find that they're going to get the pump that they need from their insurance plan, but again, they just need to keep asking those questions, because a manual pump is very different from a double electric pump in terms of how often to use it, and if the mom is in fact going back to work full time, she really does need something that's very efficient, such as a double electric breast pump.
Right. So what you may find out is that you qualify for a manual pump, but you can upgrade to a double electric, which might be the better pump for your situation.
Precisely.
Okay. Wow.
Yeah.
Do you have any other advice you would offer women for kind of taking advantage of this new benefit? It's pretty remarkable. A breast pump is quite an investment. So having that assistance of your insurance to help you prioritize breastfeeding is great.
It is. It's a wonderful service that's been added for breastfeeding moms and their infants. I would make sure that mother is armed with as much information as she can absorb prior to the birth of her infant about breastfeeding and about how to go about breastfeeding, taking education programs, and making sure that the people that she lives with are on board with her plans for breastfeeding. And making sure that they're educated as well. That's so important that moms have that, they arm themselves with that information ahead of time, and to commend themselves for doing what they're doing, because breastfeeding is more than a feeding option. It's really a health choice. We know that, and we want to support one another, and moms need all the support they can get from not only their healthcare providers, but from the people that they live with as well.
Yeah. That's definitely true. Having help all around, whether it's professional help and help in your home, and really help even at the office too, if part of your reason is going back to work. So really making sure the community around you knows what you're planning to do, and that things are set up in advance for that to be a successful operation.
Great advice. Always talk with the employer before going out on maternity leave about what your options are, explore what others have done, and how this is going to work for you and your family.
And are there any ways that different breast pump companies like Medela, for example, also offer assistance with working with insurance? If you know that you really like a particular brand of pump, is there help that moms can solicit from your company as well?
Right, and the breast pump vendors have been very informative to families to allow them to get additional information. So I would invite mothers to visit with Medela.com, breastfeeding.com, and look for, search for ACA, the Affordable Care Act, in the search engine, and there is information that will help them to locate in the state that they live in or reside in the pump that they're wishing to obtain. So it's very helpful. It guides moms right through that whole process, and it's a wonderful opportunity to engage moms in that, how to go about getting that correct pump. The other thing that Medela does offer as well is a breastfeeding university that really allows for moms to become educated about breastfeeding prenatally, and that would be accessible as well at the Medela.com website.
So it sounds like your website is a good first visit, maybe before even picking up the phone to the insurance company.
Absolutely, absolutely. A great first step as well.
Great. Well, thanks so much for being here today. It's been great to talk to you, and this is really exciting. I know when I had my son, none of this was in place, and it certainly would have been helpful for me. It can be confusing choosing a pump, so knowing that you also have your insurance company behind you is awesome.
Terrific. Great. Thanks for this opportunity, and congratulations to all those mothers and mothers-to-be out there listening in today.